everyone, and thank you for tuning in to my quality improvement project titled Enhancing Post-Concussion Education for Parents and Athletes. Today we'll be talking a little bit about the problem, the background, the PDSA cycle, the lessons and limitations, and the conclusion. Currently at Queen Creek High School, when a student athlete is diagnosed with a concussion, the athletic trainer calls the parent. The incident is then documented on the documentation system. At that time, parents are also given details about how their student sustained the injury, what to expect in the next few hours and days, and are given the school's physician information for follow-up care. The problem is there's no educational material to provide to the parents for reference in case they have any questions or need to contact the physician and or athletic trainers. Having this educational handout can reassure the parents to help them retain the information verbally provided. So the gap is that the parents are told how to provide care for their child when they receive the call but cannot recall the information later on, so their child may not be receiving the appropriate care or loses the contact information for the school's physician or athletic trainers. As clinicians and athletic trainers, we are aware of the epidemic of sport-related concussions. Queen Creek High School is a large Division VI high school located in Queen Creek, Arizona. Division VI is the highest division within the state. There are 2 athletic trainers, 1 full-time athletic trainer, and 1 part-time assistant, which is myself. We also have a school nurse who is an RN and over 2,500 students at the high school itself. We have over 500 student athletes that participate year-round, and many of those are multi-sport athletes. The issue is that we have the lack of anticipatory guidance following a sport-related concussion. The current process at Queen Creek High School, which is shown on the left-hand side, is when a student athlete sustains a concussion, the athletic trainer calls the parents. At that time, the information is provided regarding how their child got injured, provides instruction as what to do the next couple days, as well as inform them of any red flags that would warrant a trip to the emergency room. The injury is documented within the school's documentation system. The problem with this process is there's a lack of reassuring educational material to provide to the parents for reference. If there's an educational handout to reassure the parents, it may help them remember some of the information that was provided on the phone call. On the right-hand side is the improvement flow chart that also includes the educational handout. On this slide here is a fishbone diagram that demonstrates some of the issues that are contributing to the problem. So there is a full-time athletic trainer and a part-time assistant. Sometimes they don't work together, and so there is a lack of communication. Additionally, with an athletic director and a physician, they're both busy, and there isn't always that communication in between them. Parents, there sometimes can be a lack of communication regarding feedback on how their child is doing or feedback on the handout itself. And patients themselves. So patients themselves can be non-compliant. They could not tell the athletic trainer about their injury, or maybe they just don't think they have one, so they just don't say anything at all. Due to the various available educational interventions post-concussion, the head athletic trainer and myself researched which educational interventions would be most appropriate at Queen Creek High School. There was an option of creating one from scratch using the best available research, using the one created by the CDC Heads-Up program, or using the one created by our directing physician, the one that he uses at his clinic. After working closely with the head athletic trainer, we decided the best option would be to use our directing physician's educational handout that had his contact information on it as well as treatment recommendations. The goal of this educational intervention post-concussion was to help guide treatment following a concussion. Additionally, it was a reminder for parents and guardians what they should be doing for their child, as well as provide the contact information for the physician. The clinical value compass helps clinicians view a patient's injury, illness from various directions, allowing for whole person health care. The compass consists of 4 points consisting of functional status, cost, satisfaction, and clinical outcomes. With the implementation of a post-concussion educational handout, functional status could improve by decreasing the amount of school and sport the child ends up losing. Clinical outcomes should also improve, which overall could improve the patient care and quality of life. Receiving parent feedback will help determine the level of parent satisfaction. On this slide here is the layout of the Plan, Do, Study, Act cycle. Over the next few slides, we'll be going into each of these pieces individually. The first phase of the Plan, Do, Study, Act cycle is the plan phase. This phase includes the testing or observation of the use of the educational handout. Before the small observation, the educational handout was created. I worked with our team physician to receive a copy of the educational handout he used in his office. After that, the athletic director confirmed it's acceptable to use this handout. The final step was to send home with a couple patients who sustained a concussion to receive feedback from the parents. This project was successful because there was a completion and implementation of the handout for the remainder of the spring season. On the screen here on the left-hand side is the back page with the treatment recommendations of the handout. On the right-hand side is the important information for parents and students. The second phase of the PDSA cycle is the Do phase. This is where we tried out the test on a small scale. We used the student athletes in the spring athletic season since this was the smallest number of athletes. When a student athlete was diagnosed with a concussion, they were given the handout before they left the training room, and parents were informed of the handout while they were on the phone with the athletic trainer. If an athlete was given the handout or not, it was recorded in this Excel form. At the end of the season, it was tallied the number of concussions diagnosed and how many of those athletes received the educational handout. The third phase of the PDSA cycle is the study phase. During this phase, the information was tracked on the Excel document and was analyzed and studied. The data analyzed were the results recorded on this Excel sheet. When the athletic trainer diagnosed with a concussion and whether the handout was received is what was recorded. The fourth and final phase of the PDSA cycle is the ACT phase. In this phase, we redefined our change based on what we learned in the study. After we analyzed the data, we looked to see where changes could be made to the process. Fortunately, we didn't have any negative feedback or issues with implementing this educational handout. Moving forward, I would like to work on implementing the handout at the middle schools in the district, as well as in the nurse's office for the non-sport related concussions. The next steps will be implemented in the following school year, beginning with fall sports and a whole new PDSA cycle. This quality improvement project has provided benefits and barriers to the use of educational handouts following a sport-related concussion. Communication between busy physicians and administrative school staff can be difficult, which fortunately was not an issue in this project. However, receiving parent feedback took more time than anticipated. The handout was also sent to the school nurse for approval as well, which added some additional time to the timeline. Ultimately, as clinicians and researchers, we understand that ensuring best patient care takes diligence and time. Reflecting on the first phase of the cycle, it was difficult and timely to determine which educational handout to use. There are many great resources provided for parents in the realm of concussion, as well as research to create a handout specific to Queen Creek High School. Due to the limited time available within this study, it was most feasible to use the educational handout already created and implemented by our team physician. The goal was to have unanimous approval of the educational handout from both the directing physician, school administration, and athletic training staff. After working closely with the head athletic trainer, our physician, the educational handout that we implemented was provided to 5 athletes to sustain a concussion during the remaining 7 weeks of the spring season. This included spring football. Additionally, each of the 5 athletes were seen by our directing physician within his office. Feedback was received from 2 of the parents and guardians of the patients. The feedback was positive. One parent, who was also the individual in charge of our football booster club, provided suggestions that we will implement next school year. She suggested that both athletic trainers' contact information, as well as our specific concussion policy, including our policy on baseline testing, be included. Parents and guardians also stated that they felt more comfortable providing care for their child, and it was a good reminder to make an appointment with our physician. Moving forward, I'm going to create a second form with a bit more specific information pertaining to the school itself, as well as the suggestions from the parents that will be attached to the educational form. The use of anticipatory guidance can be beneficial in the medical field, specifically within athletic training. However, when implementing anticipatory guidance following concussions at the secondary school setting, there are several factors that need to be considered. While in this study, we were able to implement and provide post-concussion education handout, improvements in the flow process need to occur. With the continued use of this educational handout in the athletic training room at Queen Creek High School, patient outcomes can continue to be improved. Here are the references. Thank you for listening, and I hope you have a great day.